Hello everyone, welcome to FMT PYQs. I'm audible and visible properly. I'm audible. Audio video, is it clear? Okay. Yes, let's start. Hello students. Now let's discuss PYQs, that is previous year questions of Forensic Medicine and Toxicology. I'm going to discuss around 40 questions in next 1.5 hours, and answers are very brief and to the point, just to help you for your upcoming examination, INICET exam. Okay, let's start with the PYQs. So this is the question asked in recent exam. Which of the following is not a part of right slogan for snake bite treatment? One very commonly asked question in your exam is about the snake bite. As you know, the snakes are classified into Elapidae, Viperidae, Hydropidae. That is very commonly asked. Elapidae means they are neurotoxic. Viperidae, they are actually the hemotoxic, and Hydropidae, they are actually myotoxic. The question here is, which is not the part of the treatment or the slogan right? What we can see here, a case of snake bite. So R for, what is R for? The R is for reassurance. The reassurance is a very important component of the treatment, because one of the most common cause of death in snake bite is fear. The fear causes cardiac arrest. So R is the component. I for immobilization. You need to immobilize the limb. So when you do immobilization, the entry of venom into systemic circulation from superficial lymphatics is slow. So immobilization is a very important component of the treatment. GH. GH means get to the hospital. And T for tell the doctor about the signs and symptoms of neuroparalysis or hemotoxicity. So get to the hospital, that is also a component. So what is not the component? So that is the incision. So the incision is not the component of snake bite treatment. According to K.S. and Reddy, 33rd edition, page number 565. What are the do it and don't in case of snake bite? One is the reassurance, immobilization, get to the hospital immediately, telling the doctor about the emergence of the symptom. What are the symptoms in neuroparalysis? That is ptosis, facial muscle weakness, patient is unable to talk, unable to drink. So all these are the features of neurotoxicity. Hemotoxicity, you will get bleeding from the site, vesications or blisters at the site. Okay, so that they're all the signs and symptoms. What are don'ts? Tight tourniquet. See, when you apply tight tourniquet, that causes gangrene formation. Whenever applying some tourniquet, the pressure should be less than diastolic blood pressure. That is around 50 to 60 millimeter of mercury. That can be asked in your exam. So the one preferred is Sutherland wrap. Incision and suction, that should not be done. The washing increases the entry of venom into the systemic circulation. That should be avoided. Electrotherapy, cryotherapy, that is also should be avoided. Now look at this. So this is the scenario where the victim suffered from poisonous snake bite, and what you can see here, multiple tourniquet. So what it causes? So this causes gangrene. Okay. So what is the preferred method? The preferred method is, this is the one which is known as Sutherland wrap. So this is how you should apply wrap. So the pressure should be less than diastolic blood pressure. So that completes the question number 1. Question number 2. Which of the following is false in respect to autopsy finding? Okay, autopsy finding. What is autopsy? Autopsy means necropsy or the postmortem examination. So let's see the options. Adipocere occurs after body comes out of the water. Yes, this can be. So adipocere, it is commonly seen in drowned dead body. That is true. Cadaveric spasm occur in specific muscle. That is also true. Cadaveric spasm known as cataleptic rigidity. Like example, so this is the cadaveric spasm. That is contraction of muscles of the hand and the forearm, which is antemortem phenomena. That is the cadaveric spasm. Or, in case of drowning, mud, aquatic plant in the hand like this. So this is the cadaveric spasm, which is antemortem phenomena known as cataleptic rigidity. That is also true. Greenish discoloration is a feature, that is an early sign of putrefaction. Yes, in case of putrefaction, because of the action of Clostridium welchii, the skin color, especially at the ileocecal junction, it can be green because of sulf-methemoglobin. Remember this, sulf-methemoglobin. So that is also true. But look at the option C. Postmortem lividity is seen in the lower limbs in death due to drowning. That is wrong. See, in case of drowning, what happens actually? Look at this. So this is the attitude of the dead body or the position of dead body in case of drowning. This position is known as face down position. Face down position or buttocks up position. So in this classical case of drowning, you will see postmortem hypostasis over the front of the body. That is at the frontal region of the head and anterior aspect of the chest. There can be postmortem hypostasis over the lower part of the lower limb, especially the front aspect. So neck, head, front of the chest, lower arm and the leg are the sites of postmortem hypostasis. So with this funda, now you can see here postmortem lividity is seen in lower limbs. That is partly wrong. Not in the lower limbs. Only the part of the lower limb it is seen. So Answer is C. Now, question number 3. A person has died from drowning. All are probable signs of antemortem drowning except. What is antemortem drowning? Antemortem drowning means the drowning in which the person was alive at the time of incident of drowning. He was alive. Like example, antemortem hanging, antemortem drowning, antemortem bone injury. All these are the commonly used terms in forensic medicine. So all are the features except emphysema aquosum. That is true. Emphysema aquosum is a feature of live conscious drowning. When person is alive, so when there is a drowning, the water enters into the lung. The person try to exhale the water from the lung. There will be intense breathing activity. That intense breathing activity can lead to rupture of the alveoli, and also there can be hemorrhages around the alveoli. So dilated alveoli, that is known as emphysema aquosum. So that is correct. Diatom test positive. Diatoms are unicellular algae. They are having extracellular coat of silica ions. When they are found in the bone marrow and in the brain, that shows that the function of heart is intact. That means it is antemortem drowning. White froth. The white froth coming from the nose, nostril, which is fine leathery froth, which increases on chest pressure. So that is a feature of antemortem drowning, but it is non-specific. So it can be seen in antemortem drowning. It is partly wrong. It's okay. Now, washerwoman hand. Remember this, washerwoman hand. The washerwoman hand, it is not a specific feature of antemortem drowning. It can be seen in hypothermia also. So that's why answer is B is the correct answer. So look at this. So this is the classical washerwoman hand. Classical washerwoman hand. So what you can see here, water imbibition. There is a water imbibition into the superficial layers of the skin. So sometimes what happens? So there can be separation of epidermis from the dermis. So that is known as glow and stalking appearance of the skin. That can be seen after 3 to 4 days in case of drowning. So this is the washerwoman hand, and what you can see here, there can be soddening, there can be bleaching, there can be wrinkled skin. So when you see in entire hand, the time since death probably 24 hours. What you can see here, this soddening is seen in the entire hand. That means time since death is 24 hours. It is a non-specific finding. It can be seen in drowning also, in case of hypothermia also. So yes, this is about the question number 3. Question number 4. Autopsy image showing extensive charring. The charring means blackening. Okay, the charring means blackening, and there is a red line of demarcation. Whenever you see a red line of demarcation, it must be antemortem bone injury. Okay, so it must be antemortem bone causing blisters. When blister containing protein like albumin, globulin, that is the feature of antemortem bone injury. In barbiturate poisoning, you will see blisters, but red line of demarcation is very rare. Edema due to chemical burn. In chemical burn, you will see charring, but that is very rare finding. Postmortem blisters. In postmortem blisters, you will not see red line of demarcation and protein inside the blisters. So answer would be antemortem burn causing blisters. Now let me discuss some 3 important MCQ. Antemortem. So there are three questions commonly asked. What is the feature of ante-mortem drowning? Your answer should be cadaveric spasm. What is the surest sign of ante-mortem hanging? Can you guess? Your answer should be dribbling of saliva at the angle of mouth. What is the feature of sure sign of ante-mortem bone injury? Your answer should be soot particles in the trachea, lung, and the bronchus. So, 3 MCQ that can be asked in your upcoming exam. Now question number 5. The next question, Blackfoot disease is associated with which of the following poisoning? Okay, the question is Blackfoot disease. Let me check. Okay. Blackfoot disease is associated with which of the following poisoning? Options are cadmium, arsenic, antimony, and bismuth. So your answer should be Blackfoot disease, that is arsenic is the correct answer. Blackfoot disease. So in case of arsenic poison, there can be gangrene of the foot. That gangrene of the foot is known as Blackfoot disease. So the answer is arsenic. In cadmium poison, the cadmium poison also known as 𝐒𝐿 disease, characterized by pathological fractures. So that is not the answer. In antimony, nothing called Blackfoot disease. In bismuth also, it is not seen. So your answer should be, that is arsenic is the correct answer. Yes, student, let me check some network issue. Give me 2 minutes. Question number 6. A 16-year-old girl was brought to you by police with her mother for alleged case of rape, what will be the first step done by you as a medical officer? So it is a case of rape and the age is around 16 year. 16 year. Okay. So the options are start the examination and documents injury, take proper detailed history, preserve clothing, obtain her consent. So here, examination of victim of rape that comes under 164A CRPC. 164A CRPC. In 164A CRPC, the very important component is the consent. Is the consent. So here, obtain her consent is the first step. Then you can do preserve clothing, take proper detailed history, start examination and documentation of injury. That and all you can do it later. So the answer should be D is the correct answer. A person with firearm injury, only abrasion collar with inverted margins are seen. There is no blackening, there is no tattooing. Identify the range. So here there is an inverted margin. There is an inverted margin. Inverted margin abrasion collar is a feature of entry wound. Okay. But here, what is the range? Close range, near range, contact range, and distant range. Okay, there is no blackening and there is no tattooing. So your answer should be the blackening is seen in case of close shot. The blackening is seen in close shot. The tattooing is seen in case of near shot. In contact shot, you will see muzzle imprint. Muzzle imprint. Okay. So that is not given here. So your answer should be distant shot is the correct answer. The answer is distant shot. So there is an abrasion collar. The abrasion collar is because of the spinning movement of the bullet over the surface, and there will be inverted margin. You will see grease collar also in case of entry wound. You will see the entry wound. You will see bullet wipe. You will see abrasion ring, and also you will see the contusion ring. All these are the features of entry wound. Entry wound. Okay. So the answer would be distant shot is the correct answer. Okay. The next question, fornication or malignant symptom is seen in chronic addiction of fornication and malignant symptom. So what is formication? The formication of malignant symptom is also known as tactile hallucination. Tactile hallucination. Okay. So this tactile hallucination, they are seen in case of cocaine poison. So your answer should be cocaine is the correct answer. In cannabis poison, you will see run amok. Characterized by impulse to murder. In opium poison, you will see opium withdrawal syndrome. Okay. In MDMA, it is a party drug. So that is not characterized by malignant symptom or formication. So your answer should be cocaine. And one more point you must know here, in tactile hallucination, because of this hallucination, there can be multiple scratch marks over the body. Multiple scratch marks over the body. Antidote for morphine overdosage. Morphine. So morphine is a opium, the very simple. Whenever there is an acute morphine poison, that is characterized by three important clinical features. What are three important clinical features? One is the coma. The second one is respiratory depression. And the third one, that is the meiotic pupil. So in case of morphine acute poisoning, the treatment is naloxone, or what you can use naltrexone also. So answer is naloxone. In case of chronic addiction, in case of de-addiction, you can use methadone. So methadone is used in de-addiction. Okay. So answer for this question would be naloxone is the correct answer. Atropine, that is not used. Atropine is used in case of OP poison. Pethidine, no. Methadone, that is used in case of chronic de-addiction. So your answer would be, correct answer is naloxone. Yes, question number 10. A 20-year-old woman is brought to emergency department by the police due to being found unresponsive in the park. At the scene, an empty syringe was found. Her respiration is 6 per minute. Physical examination shows depressed mental status. Bilateral track marks are seen. And there is a meiotic pupils. So what is the antidote? The antidote would be, again, naloxone is the correct answer. We discussed already the triad in case of OP poison, myotic pupil, respiratory depression, and coma. So atropine that is used in case of OP poison, not pethidine, it is not methadone. Next question. During examination of alcoholic patient has red eyes, the breath smell shows alcohol, that is also there is a conjunctival chemosis. He is conscious, his motor coordination is normal, he can walk in a straight line, can talk normally. Which of the following statement is true? So here there is a smell, conjunctival chemosis is present. So this must be patient had consumed alcohol but not under its influence. Not under its influence. That is the correct answer. And the legal limit of alcohol is 30 milligram percentage. The next question asked in INICET 2022, which of the following is not a cardiac poison? Which of the following is not a cardiac poison? So that is the question asked in your exam. So options are Atropa belladonna, Aconite napillus, Cerebra tivitia, Digitalis purpurea. So Atropa belladonna, it is not a cardiac poison. So Atropa belladonna, it is a deliriant. It is a deliriant. Aconite napillus, it is a cardiac poison. Cerebra tivitia, that is also cardiac poison. Digitalis also cardiac poison. So Cerebra tivitia means yellow oleander, and Nereum odorum, that is a pink oleander or it is white oleander. And Digitalis purpurea is also known as foxglove. Let's see what are the important cardiac poison that can be asked in your exam. So this is the first cardiac poison. Can identify this? So this is the aconite. Aconite. The entire plant of the aconite is poisonous. The root is the most poisonous. And in case of aconite poison, you will see a finding known as hippus. Hippus. So what is hippus? Alternate constriction and dilation of the pupil. Now the second one, this is the yellow oleander. You can see here the yellow color flower, which is nothing but Cerebra tivitia. And this is green mango, which is also cardiac poison. The scientific name is Cerebra odolum. Cerebra odolum. And this is the foxglove. Nothing but your Digitalis purpurea. This is nicotine. nicotine tabacum, and the last one that will be Nerium odorum. So what are the cardiac poisons? The cardiac poisons are aconate, yellow oleander, cerebrovodolum, nicotine tabacum, Foxglue digitalis. So, and in case of aconite poison, you will see hippus formation. What is hippus? Alternate constriction and dilation of the pupil. Next question. Might the following. So options are 𝐒𝐿-𝐶𝐶𝑉𝐶, Retisates, Datura and opium. 𝐒𝐿-𝐶𝑉𝐶. What is 𝐒𝐿-𝐶𝑉𝐶? 𝐒𝐿-𝐶𝑉𝐶 is a spinal poison. Spinal poison. So which consists of strychnine. So the A is equal to, that is 2. A is equal to 2. The strychnine is a spinal poison which acts on the spinal cord. It inhibits the glycine. So it causes signs and symptoms that is resembling tetanus poisoning. Retisates. Retisates that consist of abrin, which is a organic irritant, which is commonly used as a cattle poison. So that is B is equal to 1. Datura. Datura consists of hyoscine, hyoscyamine and traces of atropine. It is a deliriant. The opium that consists of morphine. So your answer should be A2, B1, C3, D4. So answer for this question is A is the correct answer. And here there are some points actually. Datura. What is the fatal dosage of Datura? Fatal dosage of Datura, your answer should be 100 seeds. 100 seeds. The fatal dosage of Ricinus communis, 10 seeds. The fatal dosage of 𝐒𝐿-𝐶𝑉𝐶, your answer should be 1 seed. 1 seed. So this is 𝐒𝐿-𝐶𝑉𝐶 seeds. The fatal dosage is 1 seed. This is Rati seeds. What we can see here, red and black color, Rati seeds. This is nothing but your Datura. The Datura has a spiny projections over the surface. And this is opium plant. All this can be asked as an image-based question in your exam. The first one is the strychnine, nothing but 𝐒𝐿-𝐶𝑉𝐶. The red and black color is the Abrus precatorius or Rati seeds, which has a spiny projection known as the Datura, and opium seeds. So the opium plant actually, they consist of opium seeds inside it. They are not actually poisonous. So that completes the question number 13. Ricinus communis. क्योंकि वो क्वालिटी नहीं आ रहा है, वीडियो क्वालिटी। अभी देख लो, सही है, देखो। ओके, okay. The question number 14. Match the following related to eruption of teeth in adults. One very commonly asked question in your exam is the eruption of the teeth. So, the first molar that appears at 6 to 7 years of age. So that means A is equal to 2. First molar 6 year, second molar 6 2s are 12 year, third molar 6 3s are 17 to 25 years. Third molar, when it appears, erupts 17 to 25 years. So that is B is equal to 3. Incisor, it's around 7 to 8 years. C is equal to 4. And the canine, that is 11 to 14 years. So D is equal to 1. So your answer should be A is the correct answer. So A is the correct answer for this question. So what you must know, age of eruption of permanent dentition. First molar, it erupts at 6 years. You can remember second molar 6 2s are 12, it's around 12 to 14 years. Third molar, it is around 17-25 years. Central incisor, it's around 7 years. The 6 is over, you can start with the 7. CI 7 years. Lateral incisor 7 years. That is around 8 years. 8 years. First premolar, second premolar in canine. This is 9, 10 and the 11 years. So you can start with the 7 for central incisor. The lateral incisor, that is the 8 year. First premolar, that is the 9 year. Second premolar 10 year, and the canine, that is 11 year. So this is how you can remember the dentition of, that is permanent dentition, age of eruption. One more question asked in the exam, what do you mean by mixed dentition? The mixed dentition means between 6 to 11 years. 6 to 11 years. Between 6 to 11 years, the total number of teeth within the oral cavity, that is constant, that is around 24. So this can be asked in your exam. 24. 24. So between 6 to 11 years, total number of teeth in the oral cavity, that is constant, that is 24. Now, question number 15. A child came with the presentation of froth at the mouth. There can be fine leathery froth at the nostril and the mouth. That is the feature of drowning. Recovered from scene of crime. All the following seen in autopsy findings in above case except. That means it is a case of drowning. All are seen except ballooning of lungs. That is known as emphysema aquosum. That can be seen. emphysema aquosum that can be seen, that we discussed already in the question. Cadaveric spasm with the mud in the hand, that is also true. Cadaveric spasm with the aquatic matter mud in the hand is a feature of antemortem drowning. Fault of hemorrhages, so they are the hemorrhages, they are seen at the lungs, usually at the base of the lung, that is also a feature of drowning. Arsenic in hair root, why arsenic in hair root? So that is the answer for this question. So answer is D is the correct answer. And remember, the most characteristic finding in case of antemortem drowning, your answer should be cadaveric spasm with the aquatic matter. Tattooing in case of firearm injury is due to. Tattooing means they are superficial entry wounds around the main entry wound. That is because of unburnt gunpowder. Let's say now, let's see. Say example, this is the entry wound. This is the entry wound. Surrounding entry wound, you will see like this. So this is known as tattooing. They are superficial wounds around the main entry wound. And this tattooing is because of what? Unburnt gunpowder. And one more question here asked, dear students, whenever tattooing is seen, so it is the range of near shot. I'll write here. So this is the feature of what? Near shot. Near shot. This can be asked in your exam. Close shot. What is the feature of close shot? Your answer should be blackening. Blackening. And one more question can be asked. What is the feature of contact shot? Contact shot. Contact shot, you will see cruciate shape. And also, you will see one more finding, muzzle imprint. Muzzle imprint. Muzzle imprint. So what are the two important features of contact shot? Your answer should be cruciate incision and muzzle imprint. What is the feature of tattooing? Your answer should be, that is the feature of, that is near shot is tattooing. The feature of close shot is, your answer should be blackening. And one more point, remember, in most of the cases of entry wound, it is small inverted margin. You will see abrasion, collar, and also the grease collar. That is also very commonly asked. And one more entrance point here, inner table beveling. Inner table beveling, that is seen in case of entry wound. Outer table beveling, that is seen in case of exit wound. So this can be asked in your exam. So once again I'll repeat, muzzle imprint, cruciate, they are the feature of contact shot. Blackening is the feature of close shot. Tattooing is the feature of near shot. Inverted margin, abrasion collar, grease collar, small in size, all these are the features of entry wound. This is very commonly as topic in your exam. Next, patient had history of previous surgery, came with a history of abdominal pain and the fever. X-ray abdomen was taken, finding is given below, this corresponds to. What would be the answer? What would be the answer? Can you try this question? Can you try, all of you? Try. Hey, Swapna, can you try this? Yes, come on. What would be the answer? right? Options are res ipsa loquitur, res ipsa loquitur, medical jurisprudence, medical jurisprudence, novus actus interveniens, vicarious liability. So what would be the answer? Right? So here, this is the fact inside. So which is this is a fact actually. You can see the seizure inside the abdomen. That is the fact speaks for medical negligence. So this is nothing but res ipsa loquitur. Res ipsa loquitur is the correct answer for this question. Okay. It is not medical jurisprudence. Medical jurisprudence is a broad term. It is the application of legal knowledge in the field of medicine known as medical jurisprudence. What is novus actus interveniens? Novus actus interveniens is some unexpected, unforeseen act that enters between the patient and the doctor, leading to some complications. So novus actus is a unexpected act, also known as act of God. Vicarious liability. It is a liability of the senior for the action of junior. So that is known as respondent superior. Doctrine of captain of ship. Doctrine of deep pockets. So it is not the answer. Answer would be res ipsa loquitur. And one more point you must know, res ipsa loquitur applicable for criminal negligence as well as civil negligence. Now, question number 18. Finding in the image given below. So what is the finding in the image given below? Can you see here? Can I answer all of you? Can you try this? Can you try this? Let's see who is going to answer this. Let's see who is going to answer this question. Come on, come on, come on. Let's see who's going to answer. Yeah. So what you can see here, parallel lines like this. Like this, you can see the parallel lines. So whenever you see parallel lines, it must be parallel lines. It must be graze abrasion. So graze abrasion is the correct answer. So the answer for this question is graze abrasion. So here what you can see here, it involves only the epidermis, not involving the deeper dermis. There is no cut actually. So it must be graze abrasion. What is contusion? The contusion means rupture of the tissues, collection of blood in subcutaneous tissue that is not visible here. Laceration. Laceration is also known as tear. It is because of the blunt object. Like example, split laceration, stretch laceration, cut laceration, owl's laceration. So it is not laceration. Stab wound, you will see entry wound, or you will see the sharp edges. Depth is the maximum dimension. So with this now, your answer should be graze abrasion. Now, identify the type of asphyxial death. Can you try this? Can you try this, dear students? Can you try this? So what you can see here, there is a iron collar which is placed around the neck and which is tightened from the behind. So this must be garroting, also known as Spanish windlass. So this is Spanish windlass. It is practiced in Spain and Portugal as a method of judicial execution. And how to differentiate between hanging and this? Hanging, the weight of the body acts as a constricting force. But here what you can see here in the picture, so the feet is on the ground. So the body weight is not acting as a constricting force. It is the force from the external that acts as a constricting force. It must be a type of strangulation. It must be known as garroting or Spanish windlass. What is lynching? The lynching means homicidal hanging. Homicidal hanging. What is Bansdola? Remember Bansdola by using bamboo stick. So one bamboo is placed in the front, one is on the posterior side and anterior side, and the twisting of the bamboo stick and leading to death of the person known as the Bansdola. Mugging. Mugging means constriction of neck at elbow bend or the knee bend, that is known as mugging. So the answer would be A is the correct answer. A is the correct answer for this question. Okay, good, Swapna and others. Good, all are answering. That's really nice. Now we are into the question number 20. Question number 20. Here, it's a case of intracranial hemorrhage. 76-year-old lady presents to emergency department with increased somnolence and lethargy. There's a history of blunt trauma. The head CT shows crescent-shaped hyperdensity. Crescent-shaped hyperdensity that crosses suture line. So whenever the word crescent-shaped, it crosses suture line, so it must be a case of subdural hemorrhage. Your answer should be subdural hemorrhage. In extradural hemorrhage, remember, it is limited by the suture line. It is because of bleeding from the middle meningeal artery. There can be biconvex appearance, not crescent-shaped appearance. It is not SAH. In SAH, there is an extensive subarachnoid hemorrhage at the base of the brain because of rupture of berry aneurysm. So, and also in SAH, you will see throbbing headache, worst headache of the life, sudden death, usually in the middle age or the young age. ICH, that is intracranial hemorrhage, that's a broad term. That is not the answer. The answer would be STH is the correct answer. It is STH is because of bridging veins. Bridging veins. Bridging veins is the correct answer. Okay, this completes the question number 20. Most common cause of death in cold water drowning. In cold water drowning, the cold water stimulates vagus nerve. When vagus nerve is stimulated, it causes vasovagal inhibition and death. So your answer would be vasovagal inhibition. It is also known as hydrofusion. Hydrofusion. Septicemia are secondary infections. That is the common cause of death in secondary drowning. That can be asked. Sudden laryngeal spasm. It is seen in case of dry drowning. Hyperkalemia and hemodilution. That is seen in case of freshwater drowning. Freshwater drowning. So answer for this question is vasovagal inhibition. Now, next question. Which tragedy is due to consumption of? What would be the answer? Can you guess? Which tragedy? What would be the answer? Come on. Yes, try all of you. Try. See, it is due to methyl alcohol poisoning. Okay, the answer would be methyl alcohol. So what happens? Methanol, when it is consumed, it converts into formaldehyde. Formaldehyde is converted into formic acid into CO2 and H2. This formaldehyde, which can cause coma, this formic acid can cause us blindness. So the question can be asked, which are the toxic derivatives of methyl alcohol? The answer should be formaldehyde, formic acid. And these derivatives, they are toxic metabolites. They can lead to hemorrhages. One well-known hemorrhage is Fontaine hemorrhage. So, when methanol is mixed with the ethanol, when it is consumed, it leads to blindness, it leads to coma and death. This tragedy is known as Hooch tragedy. Okay, answer would be methyl alcohol. Now let's see what is the treatment. The treatment would be either fomepizole or it is ethanol. Fomepizole or it is ethanol, which inhibit the formation of formic acid and the formaldehyde, and it reverses signs and symptoms. Why not ethyl alcohol? Ethyl alcohol is good for drinking. It's a party drug. That is not the answer. Red phosphorus is non-poisonous because not absorbed in the body. So it is not the answer. Mercury poisoning. Mercury poisoning presents with a different scenario. There will be tremors. There will be, erythism and all. So that would not be the answer. Answer would be methyl alcohol. Next, cause of phausy jaw. What is the cause of phausy jaw? See, phausy jaw means it is like a osteomyelitis of the jaw. What we can see here in phausy jaw, you can see here the pus formation. You can see the pus formation. This is the classical phausy jaw, and it is usually because of consumption of yellow phosphorus. Your answer should be yellow phosphorus. Yellow phosphorus is highly poisonous. So it is the content of most of the rat poison, most of the insecticide is highly poisonous. When consumption of yellow phosphorus or inhalation of vapors of yellow phosphorus or taking high amount of yellow phosphorus accidentally, that leads to phausy jaw. And one more thing, one more question very commonly asked, what is the commonest organ affected? The commonest organ affected by phausy jaw or commonest organ affected in case of yellow phosphorus poison, your answer should be liver, because it causes hepatic failure. It causes hepatic failure. Okay. Red phosphorus is non-poisonous, not the answer. Mercury, not the answer. Methyl alcohol we discussed, not the answer. So hepatic failure, hepatic necrosis is the feature of yellow phosphorus. Now look at this. There are two pictures. One picture showing phausy jaw, other picture showing matchstick and a matchbox. That is red phosphorus. Red phosphorus is non-poisonous. Now, identify the finding given in the image. So, can I answer this? Answer this question, all of you. Try this question. Try this. Identify the finding in the image. Options are split laceration, Owl's laceration, laceration looking incised wound, stab wound. Stab wound. What would be the answer? Yes. So what we can see here, bridging of the tissues. Okay, you can see here bridging of the tissues. Bridging of the tissues. So bridging of the tissues is a feature of split laceration. It is commonly occurs over the bony prominences. Bony prominences. Avulse laceration characterized by flaying. Flaying. This means detachment of the tissues. Laceration looking incised wound, that is commonly seen over the scrotum, commonly seen over the axilla and over the neck. Stab wound, that is not the answer. The answer would be split laceration, correct answer. So what is the finding? Bridging of the tissues. Identify the finding in the image. There's one more finding here. So this is the finding. Can I try, all of you? Can I try this answer for this question? So what we can see here, there is a tree-like pattern, tree-like greenish discoloration seen over the anterior part of the chest, over the neck, root of the upper limb, or in the lower limb, or over the abdomen. It is seen in case of putrefaction. What is that known as? Try now. Try. Rajneesh Mishra, Rajneesh Meena. Can you try? So this is classical marbling. This is marbling. When it is seen usually between 24 to 36 hours. Prinsloo-Gordon artifact. So Prinsloo-Gordon artifact, it is a postmortem artifact, which is an unreal thing. It is because of the postmortem hypostasis. So bleeding at the trachea and the esophagus, that is known as Prinsloo-Gordon artifact. Cataleptic rigidity. Cataleptic rigidity, nothing but cadaveric spasm. Suggulation, nothing but postmortem hypostasis. So answer for this question, tree-like greenish discoloration over the chest. Your answer should be marbling, correct answer. Marbling. Question number 26. Crushing of hair follicle is seen in. See, crushing of hair follicle. Whenever word crushing is there, your answer should be laceration. Okay? Your answer would be laceration. Whenever word is there, cutting is there, either it should be incised wound or it should be stab wound. Not the stab wound, not the incised wound. And laceration looking incised wound, that is seen over the scrotum we discussed. Your answer should be laceration. Laceration, what is the finding? Bridging of tissues, especially split laceration. Law related to insanity. Can I answer this, son? Law related to insanity. Insanity means insane person. So there is a lack of reality. Like example, schizophrenia, delusional disorder, mania, bipolar disease, insane person. Okay. So what is that? So your answer should be Curran's rule. So Curran's rule is the correct answer. So what are the rules of insanity? Magneton's rule, Durham's rule, Curran's rule, American Law Institute test, irresistible impulse test. And in India we follow 84 IPC. What we follow? 84 IPC. So when a crime committed by insane person, it is not a punishable offense. Why? Because he is insane and the act of crime is not under the influence of, or it is done under the influence of insanity. There is no motive behind it. So that is 84 IPC. So that is nothing but your McNaughton's rule. Rule of 9. What is rule of 9? The rule of 9 basically for bone injuries. Bone injuries. Sturgeon's rule basically for time since death by using potassium ion concentration in vitreous humor. Two rules are there. Media formula, Sturgeon's formula, both are rules for time since death estimation by using potassium ion concentration in vitreous. Shapiro rule, it is for rigor mortis. Rigor mortis. So answer would be Curran's rule is the correct answer. Now, question number 28. Vegetus uternus. What is vegetus uternus? See, vegetus uternus means crying of fetus from within uterus following rupture of membrane. So the answer would be, this is the correct answer. Okay. When there is a vegetus uternus, that is a feature of live born baby. Okay. That is a feature of live birth. Live birth. Option B. Fetus born after death of the father. What is that known as? Posthumous child. Posthumous child. What is fictitious children? Fictitious children means supposititious child. That means it is not the actual child belongs to her. She adopts some child or she come with some child. She presumes that or she tells the person or the court that it is the actual child of her. So that is actually known as supposititious child or fictitious children. Sign of dead born fetus. The sign of dead born fetus. Can I answer this? This is nothing but maceration. Maceration. Okay. Maceration, the sign of dead born fetus. Maceration and all very commonly asked in your exam. Okay. Like example, Spalding sign, Roberts sign, and what are the signs of live birth? All these are very commonly asked. Okay. Like hydrostatic test. Question number 29. Identify the finding in the image. Can you try this? Can you try this? So what we can see here, there is a ligature mark. So there is a ligature mark. So here the pressure is applied. Okay, pressure is applied for long hours. Long hours. So it must be pressure abrasion. Remember, ligature mark in case of hanging or in strangulation, your answer should be pressure abrasion. It is not imprint abrasion, it is pressure abrasion, correct answer. Impact abrasion. Impact abrasion, the one example is tire mark, radiator grill mark, bite mark, animal bite mark. Graze abrasion, it's a most common abrasion in road traffic accident characterized by parallel lines. Scratch abrasion, also known as linear abrasion, which has significant length, insignificant width. Your answer should be pressure abrasion is the correct answer. And one more question asked here, what is patterned abrasion? So patterned abrasion can be of two types. One is pressure, the second one is imprint. This can be asked in your exam. The pattern abrasion can be of two types. Either pressure abrasion, like example ligature mark, Imprint abrasion, like example, radiator grill mark, tire mark. This can be asked in your exam. Treatment of snake bite victim with the signs and symptoms of neurotoxicity. So what you can see here is the bite mark. Patient is having neurotoxicity. It can be ptosis, unable to drink or unable to open his mouth, unable to breathe, excessively sleepy. All these are features of neurotoxicity. So what would be the first step? What would be the first step? Can answer this? Can answer this, dear students? Lose target weight, immediate antivenom without test dose, wash for 10 to 15 minutes, debridement of the wound. Debridement of wound, definitely no. That is not the component of right. Wash for, that is also not the component of right. Your answer should be immediate antivenom. Whenever there is a neurotoxicity, when patient is in hospital, you need to start antivenom as early as possible. So antivenom is the only measure that will prevent the person from the death. The answer would be B is the correct answer. Tourniquet definitely you can apply, but it should be very loose. The pressure should be less than diastolic blood pressure. Which pattern of fingerprint appear between? This is question asked in 2021. Which pattern when it is going to appear? See, it is appear between 12 to 16 weeks of intrauterine life. Complete formation, your answer should be 24 weeks. Okay, these two are important points. Appear between 12 to 16 weeks. Complete formation, that is around 24 weeks of gestation. And fingerprint is also known as dactylography. It is one of the most reliable method of identification. Even in identical twins, you can use fingerprint as a method of identification. There are 4 types are there. What are 4 types? Loop, oval, arch, composite. What are the 4 types? Loop, oval, arch, and composite. Let's see what is loop. So this is the loop actually. Okay. So this is the loop. This is the most common one. The oval means we will see 1 or 2 circles at the center. The arch will be like arch like this, which has entry point and exit point. So this is the arch. The composite means that is mixed. Okay, so this is the loop, this is the oval, and this is the arch. And in case of loop, you will see 1 core and 1 delta. The 1 core means curving ridge. Delta means 3 directional meeting point. 1 core, 1 delta, loop. When you see 2 delta, that is oval. No delta, no core, that is arch. Composite means mixed other than the basic arch type. So that completes the dactylography, very commonly asked topic in your exam. In chronic arsenic poison, following are the clinical features. Okay, in chronic arsenic poison, you will see Aldrich Means line. That is true. Raindrop pigmentation, one of the very important finding in arsenic poison, chronic arsenic poison, is the raindrop pigmentation. Mixed neuropathy, yes. Mixed neuropathy seen in arsenic poison. Pure motor neuropathy seen in lead poison. Bone marrow depression, that is also seen. Luminescent vomitus, that is not seen in case of arsenic poison. Luminescent vomitus is seen in case of yellow phosphorus poisoning. So your answer would be 1, 2, 3, 5. 1, 2, 3, 5 is the correct answer. And one more point you must know here. What is the fatal dosage of arsenic? Your answer should be 120 to 200 milligram. Arsenic is a ideal homicidal. This is very commonly asked. And arsenic leads to a condition known as black food disease. Black food disease. The most common compound, that is arsenic trioxide, which is a colorless, odorless, tasteless compound we can mix with any food and drink. Arsenic trioxide. And one more, there's something known as red velvety stomach. Red velvety stomach. So red velvety stomach is a feature of chronic or acute arsenic poisoning. All this can be asked in your upcoming exam. You need to memorize each point about arsenic. That is all given in rapid revision videos. And also the images, there are 5 images given here. Can you see here 5 images? Can I identify all the 5? Yes, all of you try. What are the 5 images given here? So the first one is the blackwood disease. The second white color compound, that is nothing but your arsenic trioxide. And a third finding, that is over the nails, they are Aldrich-Mills line, and below there are 2 compounds, they are nothing but your Paris green and Achilles green. They are the preparations of arsenic. This point can be asked in your exam, Aldrich-Mills line. Aldrich-Mills line, they are also seen in case of thallium poison. Thallium poison. Okay. Next. So all this you must memorize. Blackwood, this is the picture. Okay, this picture. Sankhya Somalkar arsenic trioxide, Aldrich Mills line, copper arsenate, Achilles green, copper acetoarsenate, that is nothing but your Paris green, which is a stomach poison used as an insecticide. So then other five more findings. What you can see here: raindrop pigmentation, red velvety stomach, garlic smell, and erythromelagia. Erythromelagia, and arsenic can be found in dead bodies also, even skeletalized bodies also. By looking at the arsenic concentration or measuring arsenic concentration in the bones, also the hair follicles, also in the cartilages. And the drug of choice, your answer should be that is the ball. So one drug that is commonly used, that is the British anti-levisite, that is a drug of choice in case of arsenic poison. So there are 10 MCQ that can be framed in arsenic poison. Very, very important topic. Identify the mechanical injury given in the picture. So you can see here, there are parallel lines are there over the forearm caused by some blade or some sharp object. What would be the answer? What would be the answer? Swapna, Rajanish Mishra can answer this. So these multiple parallel lines, whenever it is given in exam, your answer should be hesitation cuts. Okay, hesitation cuts. They are seen in case of suicidal incest wound, commonly seen in borderline personality disorder, commonly seen in psychosis, or in case of suicidal tendencies. Okay, there is something known as defense wounds. There can be active defense wound and a passive defense wound. They are seen in case of homicidal incised wound or homicidal stab wound. Sixpenny bruise, where it is seen? Sixpenny bruise, that is seen in case of manual strangulation. Okay? That is seen in case of manual strangulation. Pattern abrasion we discussed already. Graze abrasion also we discussed. Next question. Following is used to identify vaginal cells on penis during examination of accused of rape. Accused of rape. Can you try this? Yes, yes, come on, try. Okay, come on. So vaginal cells, they are rich in glycogen. Okay. Your answer would be Lugol's iodine. So Lugol's iodine is the correct answer. So they are rich in glycogen. When it combines with Lugol's iodine, they look brown color. It is positive up to 4th day. When vaginal epithelial cells are there over the penis, when you collect those cells, when you mix with the Lugol's iodine, that becomes brown color. That means there is some substance vaginal epithelial cells. It is positive up to 4th day. Toluidine blue. Toluidine blue is basically for micro injuries over the vagina or micro injuries over the genital area. This can be asked in your exam. Precipitin test. What is precipitin test? The precipitin test basically for species identification. Species identification. Florence test is basically for seminal stain. Seminal stain. So answer would be Lugol's iodine here. So this is the Florence test. In Florence test, you will see brown color rhombic crystals of choline iodide. Brown rhombic crystals of seminal stains. Seminal stains. Toluidine blue, we discussed already. Question number 35. Identify the poisonous plant having yellow flowers and seeds are contained in pricky capsules. So it is also known as pricky poppy. What would be the answer? Can you guess what would be the answer? Try, dear students. Yellow flowers, pricky capsule, pricky poppy. So it must be seeds of Argemona mexicana. Your answer should be Argemona mexicana. Nerium odorum, it is a cardiac poison, not the answer. Pepper somniferum is a opium plant. Calotropis is a organic irritant used in abortion. The better answer is Argemona mexicana, and these Argemona mexicana seeds, they resemble like mustard seeds. When you mix mustard seed, example here, at this, you can see the mustard seed on the left side and Argemona mexicana seeds on the right side. So the mixing is common, adulteration is common. So that leads to a condition known as epidemic dropsy. Epidemic dropsy. So there can be, there can be edema, there can be glaucoma, there can be other complications like diarrhea and all. Epidemic dropsy is because of the sanguinarine that is present in the Argemona mexicana seeds. So the answer would be 𝐒𝐿-𝐶𝐷 or Argemona mexicana. Question number 36. Alleged case of murder. Dear student, murder is defined under section 300. Murder is punishable under 302 IPC. At a certain place and certain time, C saw B with a knife on that day at that place few minutes before the murder. So C saw the murderer with the knife only. He is not the eyewitness of the murder. He is the witness of the knife that is carried by the B. So this must be indirect evidence, circumstantial evidence. So what would be the answer? Indirect evidence or circumstantial evidence. So indirect evidence is the evidence from which court draws the conclusion. Direct evidence means direct witness of the murder, eyewitness. Hearsay evidence is the one evidence obtained from hearsay. He told, he said, she said, they called me, something known as hearsay evidence. That is the third party evidence. Hostile witness is a U-turn witness, one who is changing statement during court trial. In the police statement, is said that he is the witness of the crime. During court trial, he is telling that he is not the witness of the crime. He was not there at the crime scene at that day. U-turn witness is hostile witness. So that can be asked in your exam. For this question, your answer should be indirect evidence, correct answer. There are three types of evidences: direct evidence, evidence of the fact which is actual an issue. But already we discussed. Example, eyewitness in case of murder. Indirect or circumstantial evidence from which the court draws the conclusion. Hearsay evidence that is obtained from the third party. So the courtroom procedure very commonly asked, like example, oath, examination in chief, cross examination, re-examination, questions by the judge. All this can be asked in your exam. Remember, cross examination conducted by defense lawyer, there is no time limit. Leading questions are allowed in cross examination. Leading questions are not allowed in re-examination as well as examination in chief. Judge can ask question at any time during the trial. All this can be asked in your upcoming exam. Okay. Now, following are muscarinic manifestations. In OP poison, there can be muscarinic manifestation, nicotinic manifestations. One very famous mnemonic is dumbbell or sludge. So, what are they finding except? Very simple question. There can be urinary incontinence, diuresis. There can be bradycardia, tachycardia, depending upon stimulation, whether ganglia stimulated or receptor stimulated. Mydriasis is wrong. In case of opioid poison, you will see meiosis, not mydriasis. Bronchoconstriction, that is also seen. The answer should be mydriasis. Meiosis seen in case of opioid poison. What is the drug of choice in case of opioid poison? Your answer should be atropine, 2 to 4 mg till therapeutic endpoint. Which of the following is not the feature of cocaine intoxication? Can answer this. Options are tingling and numbness of the hands and feet, constricted pupil and bradycardia, hypertension, hyperthermia. Yes, come on. So cocaine is a question asked. Cocaine is deliriant. There can be tingling and numbness sensation, that is true. There can be hypertension, that is true. Hyperthermia, that is true. But in case of cocaine poison, you will see dilated pupil. So your answer should be, so this is the answer. Okay. And in cocaine poison, you will see formication or cocaine bugs. That can be asked in your exam. So question number 39. A skull was obtained from the crime scene by the police. There was a complaint regarding missing a female student. A female student is missing. Which of the following suggests that it belongs to female sex? Can you answer this? Try this question. Try. Forehead is steeper. Forehead is steeper in case of male sex. It is in case of male. Very important finding. Orbits are square, set lower on the face, rounded margin. That is a feature of male skull. Cheekbones are heavier, laterally arched. That is also of male. Your answer should be large frontal and parietal eminences. So answer would be D is the correct answer. D would be the correct answer for this question. So look at this. So this is the male. So this is the female. So what you can see here in differences very commonly asked in your exam, look at the orbit. In case of male, it is rectangular. In case of female, it is somewhat circular. And one more difference, what you can see, the mandible, it is of U-shaped in male, it is of somewhat V-shaped in case of female. And one more point here, most of the bony prominences, they are prominent in male skull, except frontal and parietal eminence. That is very, very commonly asked in your exam. Okay, so go through the differences. Is very nicely discussed in rapid revision. You can go through the rapid revision classes. Barberio test detects which of the following? Barberio test. You know, Barberio test. So remember, it is a test for seminal stain. It is a test for seminal stain. And in Barberio, we use picric acid. So picric acid combines with the spermine. It forms spermine picrate crystals. So your answer should be Barberio test. There will be yellow needle-shaped crystals of spermine picrate. So the answer would be this. Okay. Dark brown crystals of choline iodide, that is seen in case of Florence test. Florence. It is not acid phosphatase. It is not created in phosphokinase. Your answer would be yellow needle-shaped crystals of spermine picrate. Like example, this is the microscope slide. How it is visible? It visibles like this. Like this, it is visible. Okay. In case of choline iodide crystals, Florence test, it will be somewhat like this. Like this, it is visible. In case of Florence test. So both are commonly asked in your exam. Barberio test, yellow needle-shaped crystals of spermine picrate. Florence test, it is rectangular, brown color crystals of choline iodide. Both are the test for the seminal stain. Okay. Acid phosphatase is also test for seminal stain. Creatine phosphokinase also test for seminal stain. Okay, the best test is appearance of the spermatozoa or spermatic head on microscopy or on Christmas staining. So that is the feature of confirmatory test for seminal stain. Okay, so this is very commonly asked in your exam. And also the question can be asked about blood stain. Blood stain. What are the tests for blood stain? The one question confirmatory test is the Tieckmann test. Tieckmann. And the second test, Takayama test. Okay, Tieckmann's test and Takayama test, okay, are the two important tests for the blood stain. They are known as Hemin crystal test. There are certain screening tests also for the blood stain. Okay, like example, benzidine test, tetramethyl benzidine test, phenolphthalein test, Castle-Meyer test, and all. The most common screening test is Castle-Meyer test. You will see pink color appearance of the blood stain. All this can be asked in your exam. So identify this yellow needle-shaped crystals. Yellow needle-shaped crystals. This would be your Barberio test. And dear student, remember what is the most confirmatory test for blood stain? Your answer should be spectroscopic examination. What is the answer? Spectroscopic examination. Next, identify the finding in the image. Identify the finding in the image. What you can see here, you can see the tree-like pattern. Okay, tree-like pattern. You can remember like this. Fall is the mnemonic for that. So what is fall? Filigree bone. Filigree bone or arborescent marking or Lichtenberg tree pattern. So whenever this three word fall, filigree, arborescent marking, Lichtenberg tree flowers, your answer should be lightning. Lightning is the correct answer. What is the most common cause of death in lightning? Ventricular fibrillation. Okay, the answer would be A is the correct answer. Now here there is question asked about bony pearls. The bony pearls are seen in because of melting of the bone, also known as wax dripping. They are seen in case of electrocution. That can be asked. Crocodile flash burn. The crocodile flash burn, they are exogenous burn because of electric current. Exogenous burn because of the heavy electric voltage current passage through the body. There can be nodules over the body. That is known as crocodile burn. So that can be asked in your exam. What is joule burn? Joule burn, it is also known as endogenous burn. That is also because of electrocution. So once again I'll repeat. The fall is seen in lightning. Endogenous burn, joule burn in electrocution. Crocodile burn, heavy or high voltage burn. Bony pearl, electrocution because of the melting of the calcium and phosphate. There's something known as electrical petechiae that is also can be asked in your exam. What is the cause of death in case of bone injury? Either it can be neurogenic shock or because of the fluid depletion or because of the septicemia. That is the commonest cause of death after 3 to 4 days due to gram-negative bacteria like Pseudomonas infection. So this question very commonly asked in your exam. Match the following. So this is about the time period. So relaxation of sphincter. See, soon after death, there is a relaxation of sphincter, usually 1 to 2 hours after death. So A is equal to 4. Prominent marbling, that is in 36 to 48 hours. B is equal to 2. Adipose formation, 3 months to 6 months. C is equal to 3. Liquefaction tissues, that is 5 to 10 days. D is equal to 1. What is the best answer? The best answer will be A is the correct answer. Match the following. This type of question is common in INICET exam. So the answer would be A4, B2, C3, and D1. Relaxation sphincter occurs immediately after death, around 1 to 2 hours. Prominent marbling. Marbling means green color veins that is seen over the neck, axilla, and the chest. That is a feature of putrefaction. That's around 36 to 48 hours. Adipose formation, that is around 3 months to 6 months. Liquefaction of tissues occurs in 5 to 10 days. Okay, so all this can be asked in your exam. So now, saltwater drowning. What is the finding seen in saltwater drowning? In saltwater drowning, what happens? There can be heart failure due to myocardial anoxia, increased viscosity. Yes, in saltwater drowning, the more and more water from the body enters into lungs. From lungs, it enters into the seawater because of high salt concentration. So there can be hemoconcentration, increased viscosity of the blood. That is true. Hemoconcentration, that is C. Hypernatremia C, that is also true. So your answer would be 1, 3, 4. Remember, dear students, hemodilution and hyperkalemia is a feature of fresh water drowning. Okay, so this is seen in case of fresh water drowning. Fresh water drowning. This can be asked in your upcoming exam. Which of the following is seen in freshwater drowning? Again, drowning very commonly asked. There can be hyperkalemia, there can be hemodilution, there can be hyponatremia and hypocalcemia. The answer would be 2, 3, 4. 2, 3. Most common cause of chronic leg toxicity in industrial workers. Okay. Lead, industrial workers. So in industry workers or in general, the most common route is the inhalation of the lead. Your answer should be inhalation, correct answer. Absorption through the skin, that is the route, but it is very rare. Ingestion, that is also not the common. Ingestion through contaminated food and water, no. Your answer should be inhalation. Inhalation is the one. And one more point, remember, chronic leg toxicity is also known as plumbism, known as saturnism. Plumbism, saturnism, names of leg toxicity. The most common route is the air. Arsenic poison, your answer should be water. Arsenic, what is the answer? Water. And in case of lead poisoning, there can be lead lines, also known as Burtonian line at the junction of teeth and gum. It is non-specific. It is because of deposition of the lead sulfide. Okay, there can be basophilic stippling also, constipation, abdominal pain, facial pallor, encephalopathy, hypertension, impotency, abortion. So lead poisoning is very commonly asked in the exam. You must know in and out of the lead poisoning. It is discussed very nicely in rapid revision. Now, question number 46. Identify the torture method given in the picture. So, what you can see here, the person is in the prone position. His legs and arms are tied together. Okay. What is this method known as? Can you guess, dear students? Options are Gotna, Falanga, hog tying, parrot perch. So Gotna means that is placing a wooden pole over the thighs and walking on that wooden pole. That leads to extreme degree of pain because of the irritation of the nerves at the thigh region. So Gotna is not the answer. Falanga, what is Falanga? Falanga means beating on the palm and sole. That is the method of torture, beating on the palm and sole. That is not the answer here. What is parrot perch? In parrot perch, the person is suspended in supine position, not in the prone position. So, your answer would be hog tying is the correct answer. It is a type of positional asphyxia. What is this? It is a type of positional asphyxia. Positional asphyxia. This can be asked in your exam. One more very commonly asked, traumatic asphyxia. Okay. In traumatic asphyxia, there are three important findings: deep cyanosis, petechial hemorrhages, clear line of demarcation. Okay. So all this can be asked in your exam, all the torture method. Mind the following. This is about the ossification. Ossification. Fusion of inner end of clavicle. When it occurs, inner end of clavicle. Fusion of coracoid with the scapula. Sacrum becomes single bone. Lambda fusion completion. See, lambda suture. This occurs at 45 years. Okay, D is equal to 2. So D is equal to 2. Fusion of inner end of clavicle. Okay, it's around 20-21 years. So A is equal to 3. So A3, the answer would be A3, B4 and C1 and D2. And D2. So answer would be 1 is the correct answer here. So ossification centers are very nicely explained in your rapid revision. Go through that. Medial end of clavicle, sternum fused in a man who was sent into forensic department for age estimation. What is the approximate age of the person? So when sternum becomes single bone, your answer should be more than 25 years. No doubt in this. Your answer would be more than 25 years. What is the finding shown here? So you can see the green color markings over the dead body, over the chest. Okay, this must be marbling. The answer is marbling, correct answer. Filigree burn, that is seen in case of lightning, we discussed already. Postmortem staining known as sigillation, that is seen over the dependent part, not on the non-dependent part. Carbon monoxide poison, you will see cherry red postmortem staining. So answer is marbling, correct answer. One point here you must know, cherry red staining. Cherry red staining, that is seen in case of carbon monoxide poisoning. This can be asked in your exam. Last question. The cause of injury in this person. So the injury here, that is the tree-like pattern. So tree-like pattern. So tree-like pattern must be filigree burn. Filigree burn. So filigree burn, that is seen in case of lightning. The answer would be lightning, correct answer. That is B is the correct answer. Now some more MCQ that can be asked in your exam. What is the cause of death? The cause of death is ventricular fibrillation. There is one very important MCQ about the blunt force trauma that is seen in case of lightning. That effect is known as sledgehammer effect. Let me write here. Sledgehammer effect. That is seen in case of lightning. Okay. Heart liquid injury, what it causes? The heart liquid injury that causes scald. Mechanical injury can be two types, blunt force trauma and a sharp force trauma. So what are the injuries caused by blunt force trauma? Abrasion, contusion, laceration. Sharp force trauma, stab wound, incised wound. Electrocution, we discussed already. In electrocution, you will see joule burn. Joule burn. There can be crocodile skin burn also. That is because of high voltage current. There can be wax dripping. There can be, electrical petechiae. And the commonest cause of death in electrocution also, it is the ventricular fibrillation. But when there is a head-to-hand contact, so in that case, there can be respiratory paralysis also. So all these are commonly asked questions in your upcoming exam. So this completes the almost all the important MCQs asked in recent INICET exam. Any doubt you can ask me. Any doubt you can ask me. So let me discuss some three important signs in case of antemortem hanging. See, in antemortem hanging, one very important finding is dribbling of saliva. It's very commonly asked. In antemortem burn injury, your answer should be soot particle. Antemortem drowning, your answer should be mud particles in the or cadaveric spasm in the hand. Now, cocaine poison very commonly asked. In cocaine poison, pupil is dilated. You will see formication. In datura poison, pupil dilation, you will see 9D manifestation. In opium poison, you will see three findings. What are three findings? Coma, miotic pupil, respiratory depression. Okay. And MDMA, that can be asked, LSD can be asked, opioid withdrawal syndrome, alcohol withdrawal syndrome, types of delusion, types of hallucination, types of impulse disorder, run amok. Gustafson method, very commonly asked. Forgot to tell you about that. Gustafson method. You must know this. This is very commonly asked in exam. The mnemonic is APSRTC. APSRTC, the mnemonic for components of Gustafson method. A for attrition, P for paradontosis, S for secondary dentin, R for root resorption, T for transferency of root, C for cementum opposition. The most important criteria, transferency of root. Okay, Gustafsson method can be asked, dentition can be asked, ossification center can be asked in your upcoming exam. Okay, so and torture methods, we discussed many torture method. Types of laceration is very commonly asked, like example split laceration. Types of contusion very commonly asked. Types of abrasion. Postmortem changes, like example postmortem hypostasis, rigor mortis. So all these are very commonly asked in your exam. Any doubt you can ask me. So with this, I conclude the class. Thank you.